assessing essentially vaccine safety and also immune responses to that vaccine. So 2 immunisations are going to be given to each of the participants 4 weeks apart. And we'll be measuring immune responses 4 weeks after each of those doses. So I'll be seeing some early data, just to give you a heads up, probably by the end of September. All participants will be monitored for a 12-month period after the first dosing. However, should safety be confirmed and early immune responses are promising, then our partner CSL will take the vaccine through further clinical trials from about sometime in the beginning of Q4 this year. So I was reflecting last night on where we all were at the start of this year. It seemed like about 3 years ago, but in fact it was only about 5 months ago. And a lot's happened since then. To see us at this stage of clinical testing, a mere 5 months after we selected our lead vaccine candidate to what was essentially a newly emerged global infectious disease threat, is simply remarkable. So in finishing, I would just like to thank all those who've provided unwavering support for our vaccine program, both within UQ, Team 1 UQ, and also externally. And I particularly want to thank our primary funders, CEPI, along with generous support that we received from the Queensland Government, from our federal government, foundations, and our many community donors. In the end, over 2,600 individuals contributed to the efforts to advance this vaccine. And as the Premier was saying, the approach we've taken is to advance manufacturing as fast as we can while we're doing these clinical studies. So whilst these studies are underway, we will still be working in the background along with our partner CSL to advance the manufacturing so we have this vaccine at scale when it's needed. Thanks very much.
Any questions for Professor Young?
I think we've got questions afterwards.
Okay,
so
all right.
Well, this is a momentous day for Queensland. Queenslanders should be rightly very proud of our researchers and their scientists, and our scientists who are leading the world in the race to find a vaccine for COVID-19, a key piece of the puzzle so that we can start saving lives globally from this disease. As the Premier has outlined, we have one additional case here in Queensland overnight, a returning traveller from the United States. They were in hotel quarantine, normally resident of the Sunshine Coast, giving us 1,071 total cases, 4 that remain active. Yesterday, Victoria confirmed they now had 1,484 cases. Of course, we will await today's update on the situation in Victoria. But our greatest concern now relates to a pub just off the Hume Highway in New South Wales in a town called Casula, the Crossroads Hotel. I'm told it's a popular stopping point for people travelling the highway, especially truckies. Late yesterday afternoon, after receiving this information, the Department of Transport and Main Roads alerted truck driving networks that anyone who has been to the Crossroads Hotel between the 3rd and the 10th of July should go and get tested. Police are now asking anyone arriving at the borders whether they have been to the Crossroads Hotel between the 3rd and the 10th of July. And we'd appreciate your assistance, the media's assistance, in getting that alert out throughout Queensland. There is a large number of people who have been through that hotel on those dates where there are now confirmed cases of both staff and patrons being infectious during that period of time, the 3rd to the 10th of July. This is a very large contact tracing exercise, probably one of the largest undertaken so far here in Australia, in order to allow New South Wales to bring their contact tracers back that have been assisting in Victoria. Queensland is working through the details of providing additional contact tracers to Victoria to assist with their outbreaks. We all have an interest in ensuring that the contact tracing for the Crossroads Hotel is undertaken.
Well, it's wonderful to be here today to officially announce, as the Premier has said, clinical trials starting in humans here in Queensland. This is a major step forward in the backing of this UQ science that we know is leading the world when it comes to combating the coronavirus. To think that it is a Queensland University, Queensland people, Queensland brains that could crack the coronavirus virus pandemic. It's a real proud day for every single one of us. Like the Premier, I want to thank the more than 4,000 Queenslanders that put their hand up to be part of the clinical trial. It just shows that when times are tough, Queenslanders always put their hand up. So as the Premier said, over the next few months, 120 Queenslanders will be part of this clinical trial. This is a huge step forward in the advancement. And as you've heard from Professor Young, we are doing this in record time. We know that the best way to unite and recover as an economy is to crack the vaccine. And it's wonderful that Queensland is now leading the charge globally in tackling the coronavirus vaccine. I do want to acknowledge and thank everybody in the team. They are working 24 hours around the clock every single day to deliver this vaccine for the world. And it would be an amazing feat if we were able to be one of the vaccines developed globally right here in Queensland. I want to echo the Premier's comments and thanking everyone that has been involved to date. We were very proud to be one of the first partners to put $10 million on the table towards this. We know that if we can deliver a vaccine, then that will be the fastest and quickest way for us to move on from the coronavirus. And I want to acknowledge and thank everyone in the team that is working so hard to deliver this vaccine in record time.
I just want to say thank you for all of you backing what UQ is doing, for the community that, in addition to government contributions, really dug deep to make sure that we can deliver this for Australia and the world in the fastest possible time. Thank you.